So Medicaid expansion happened in 2013. We are now in 2014, so we have been enrolling people in the expansion of Medicaid for almost an entire year. What this has allowed us to do is expand Medicaid for low-income single adults up to 138% of federal poverty level. And when you think of Medicaid, you may have traditionally heard that anybody who has a low income could qualify for Medicaid, but that wasn't always the case. You had to be aged blind or disabled, or you had to fit some of the different criteria in order to qualify for Medicaid here in the state of Ohio. Now we have simplified the qualification process, so it's based on your family size and your household income. It's much simpler, and we've launched a new portal, a consumer portal here in Ohio that's called benefits.ohio.gov. And that is an easy online way for consumers to apply for Medicaid. All of our navigators, we have Carolyn and Sandra, we have a number of other folks in the local community. Anybody can assist someone go through that application process for Medicaid. It takes anywhere from 15 to 30 minutes depending on how complex the family situation is, but it is the best resource for getting somebody who is a low-income individual connected to a coverage tool. We can go ahead. And so the enrollment process that our navigators use is that they look at the household size and income, and typically we start with the benefits.ohio.gov. Periodically there are outages of those sites, and so we do get those notifications through our Ohio Network for Health Coverage and Enrollment, the Ohio Association of Food Banks. Those notices do come to us, and we push them out through our local network. So we have some of the med students on the distribution list for the NEO Council, so we let them know as well. In the event that that website is down, we can always go to the phone option. Someone can apply in person at a Job and Family Services office. In Cuyahoga County, we have 6 neighborhood service centers available for consumers where they can be served on a walk-in basis. But sometimes you really are met with a consumer who doesn't have the time to sit and wait in person for their number to be called, or they have a hard time getting to some of those different locations. And that's why the outreach components are really important, because this weekend, like Sandra is going to the Stephanie Tubbs Jones Health Center, and she'll be at a location that's easily accessible for consumers because they are coming there for another type of activity. Since we're close to the Thanksgiving holiday, there's actually a Thanksgiving turkey giveaway. And so it's important to recognize that when we do outreach, we're trying to get to where people are already going, trying to connect with other organizations that do different types of events that bring people to them. Our local churches have been a wonderful partnership because a lot of individuals and families still do go to church every weekend. And so that is also a great location, but the leadership of those churches are also viewed as trusted messengers. And that is another piece that as an outreach assister you might come into contact with as we get into some of the role plays later on today. Somebody might have some different types of questions to ask you. One of the most important things about Medicaid is that there is no deadline to enroll, not one. Whereas right now, last week we launched the open enrollment period for the health insurance marketplace. That goes for 3 months, till February 15th. For Medicaid, anybody can enroll anytime throughout the year. And then if an application is approved, it's actually retroactive to the first day of the month in which they applied. So that's another wonderful thing for the consumer to know, that if they needed to seek emergency medical services, it's retroactive to that first date of when they applied.